I think it's always exciting to see someone get to go home and to have met their goals. It makes you feel good that you're doing the things that you set out to do when you got into this profession. My name is Doreen Huntsberger, and I'm a traveling physical therapist, and I work for CompHealth.
Can you get up without the walker?
No.
Can you try? I bet you can. Good, Francis, good.
There's definitely different emotional levels depending on the patient. You get some patients that are very outgoing, very emotional. You get some patients that are very to themselves.
How's your leg feel today?
And obviously when someone has pain, you always want to credit their pain. Unfortunately, with some conditions, especially surgery, there's going to be pain. So it's a matter of working with them to work through the pain.
Good, Molly. Good, and back down.
Because it's tough, and I mean, we get the nickname physical terrorist, torturer, you know, and...
You needed a ton of help the other day.
No, only half a ton.
No, not.
When they leave, they're usually like, thank you so much, you've gotten me walking again, but it's not always a fun process.
Work on that heel hitting again, okay?
There were 3 big reasons that I decided to travel. The first was to gain professional experience in different areas so that when I do decide to settle, again, I can pretty much pick what I want to do and have the experience to get that job. The second was to financially become a little bit more stable, just to take care of some bills that I had accrued in college. Also, the benefit of the travel. I've always been very spontaneous and adventurous, and to be able to see the things that I see, traveling would probably take 10 years, if not more. It's a wonderful way to get your feet wet and decide what area maybe you want to specialize in, if there is an area.
I'm gonna let my hands off of you. I just want to see your balance. I gotcha. See those
shaky
feet working hard, huh? Are you gonna walk?
I'll try.
Okay.
Zelda has been here 6 weeks. She's had a lot of respiratory problems. She's been on oxygen. We've been trying to wean her off the oxygen.
Good. Okay. Good. Work on your breathing for me.
I am very hopeful, and I think there's always potential there, so it's just a matter if you can get them to realize it. Here in Arizona, I've decided to concentrate on my running and decided to do my first marathon. Melissa, my rep, is awesome, and I think that she really does care about me and think about my wants or needs and work with me for those. The place in California, she actually called me to tell me that it was open. I hadn't even started looking. She saw it on the schedule and said, hey, I think Doreen might like this. CompHealth is great about doing licensing. They cover any of the fees for licensing. They take care of all of the other work behind it, which is very, very nice. They will find your housing for you, which is another huge bonus. For me, with the dog, they offer a travel reimbursement. They pay the utilities, and then they will reimburse you for your local phone. I think it's always sad a little bit when you leave, because you do make friends, and specifically here, I've made a ton of friends in work, outside of work, with my marathon group, other CompHealth travelers that I've met down here. So I still write to some of my patients that have really either impacted me or I've impacted them. So they did actually offer me to stay here in Tucson as a permanent position, but I'm not ready to settle yet. And it's a great place, awesome people. I hope to see them again, and I will. But I still want to see what else is out there.